Welcome to Scan Health Can, the podcast where we explore the crucial role of healthcare supply chain. Each episode is a new chapter in the exploration of best practices, innovations, and advancements, ensuring that at the end of the healthcare supply chain, we prioritize the most vital element, human life. And understanding the people behind each link in the chain is crucial. In this episode, Dr. Anne Snowdon speaks with Dr. Alex Mitchell, a surgeon from Nova Scotia. We hope you enjoyed this conversation.
Alex Mitchell, it is an absolute pleasure to have a chance to speak with you today about your work, both as a surgeon and a particular interest you have in healthcare supply chain. So maybe just to start off for those who might be listening, give us a little background about how does a surgeon, general surgeon, actually get involved and start advancing and working on healthcare supply chain?
Great to see you as always, Anne, and a pleasure to be here on your podcast. So, how does a surgeon get involved
Yeah.
in supply chain? When stuff isn't there, when the thing you need doesn't show up and you can't understand why. You know the story, but I'll tell it, and that is, I still am a general surgeon, but at a particular time in my career, I was doing a lot of abdominal wall reconstructions, and we used fancy biologic implants, which had to be brought in special for each case. And on a particular day, the product that we required for the patient that was about to go to the operating room was not available, was not in the building, and nobody seemed to know where it was. Um, in that moment, I realized, like, hey, because of the way we special order these, they get couriered in. It was FedEx that would have been bringing it to us. And I thought, nobody seems to know where this thing is. There's no visibility. Nobody could ask a computer a question, but I happen to know that the courier company probably can. So I called FedEx, and indeed, like, they could see exactly, like, where it left the factory, like where it left the supplier, et cetera, different bouncing around and where it had landed, which was in a warehouse 20 minutes from my hospital. And indeed, they said, yeah, still here. We can see it. And so I got in my car. I drove over to the FedEx warehouse, got the package, brought it back to the hospital and it was an aha moment. It was that FedEx as a courier knew where everything was easily, and we didn't. And that started me on a campaign of asking a lot of questions about how do we deal with our supplies. At the time, I was the chief of surgery at a center that was a high volume surgical center. This started to come together as a particular area of interest.
It's such a compelling story because as a patient, you go in for a particular surgery like this one, never crosses your mind that the products the surgeon needs to actually do the surgery aren't there. Let me ask you a different question related to that. Very few or relatively few clinicians I speak to or engage with have an understanding of supply chain and why it matters. Why do you think that is when it is so fundamental, whether you're a surgeon, a nurse, a radiologist, radiology tech, whoever you are, you have to have these products and equipment to deliver care. Why is it that that's a gap for so many of our clinicians?
Um, I think fundamentally, in part, in credit to a system, right? I think it fundamentally, in part, because the system, to a large part, has always provided the things. It's just magically there, and I think it's not just clinicians that don't understand supply chain. I mean, I think public writ large in large organizations, most of the organization doesn't understand their supply chain. There's a smaller group inside the organization that does. As long, and I think it's, like understanding how the water arrives to my house in a municipal
Right.
system. If it arrives successfully and I don't pay attention, it's just like magic. It's just the stuff that I expect to be there. We haven't intentionally, and so unless we intentionally educate people and get them to understand how complicated our supply chain is, and how important it is, and perhaps sometimes how broken it is, then they have no idea. And I think it's so far removed from all of the other things that clinicians are educated with. Start with the fact that we predominantly train people to treat disease. We don't train them well to prevent disease, separate conversation, but we don't really spend much time teaching clinicians or healthcare providers business acumen, organizational structure, systems, et cetera, all the other things that really we need to run this whole crazy machine of healthcare.
Yeah, I think there's no question that it's just the expectation. You turn the light switch on, you expect the lights to go on. Similar with supply chain. Walk into an OR, you expect the tray. And yet,
Yeah.
Canada as a country has more supply disruptions than any other country in the world, and they last longer. Do you have a sense of, or can you share a bit about to what degree you gave us a very impressive example of when a product doesn't show up? Is this a day-to-day issue that clinicians face in the care delivery? Or like how is that, one of, or are there examples that just show up often that health supply chain really does impact both clinicians and their patients? Do you have a sense of that?
So that particular example, I think, is probably not rare, but not common. I wouldn't say it's that sort of, that like we don't have the stuff that we need most of the time. The flip side is what's actually true is there, hey, we can't find it. I don't know where that is. Have we got the right size? Those kinds of things. I think that happens daily. More than not, right? I think because the system, healthcare is very resilient in terms of making sure that it manages to do what it needs to do today. And in this space, the way it does that is to overstock, to order way more than it needs on any given day, to make sure that we have it, similar to what, militaries traditionally will do, like you stockpile things way beyond what you might need for today. And we leverage other things, right? We bring in the vendors' representatives who are like financially motivated to make sure that like they've got a trunk full of all the widgets that we want, among other things. And I think the end result is that we keep more on hand. We pay way more for what we might need. We might buy three and only use one. We probably waste more. Not probably. We definitely waste way more than we need, or products go expired, etc. I think we just swell to accommodate. We hoard, but no question, like the don't know where it is, can't find it, might not be there, not right size. Are these a regular occurrence for each individual surgeon or physician? Probably not on a daily basis, but system wide, are there blips of these lights all over the system every day? Yeah, there's got to be.
Do you think it's the chaotic management, where is it right size, and the back office that's sort of running around trying to find things and make sure we have things? Do you think supply chain has an impact on patients and patient care?
Oh, for
Apart from
sure.
the,
Yeah,
the challenge of, share a little
yeah,
bit about that. How
yeah.
how does it impact?
Absolutely. Well, the first thing is like when anything is harder than it needs to be to do the actual task, you're taking like system capacity and energy away from those tasks of value, right? So, as you well know, studies suggest that, clinical staff nursing on nursing units will spend, an hour or two per shift looking for stuff. All of the energy that goes into finding those things, the energy that goes into sorting out what's where, on the the budget piece, like any money wasted on expiry waste, off contract purchases, spending more on a knee replacement implant than we really needed to. All of these things takes like money in a Canadian system away from activities and products and procedures of value in a cost constrained system that's under duress. And writ large, I think then, sorry, the other like significant impact is, when people are expending that energy and money and time against those activities, then they're not, it's what are we not doing as a result? We're not spending time, energy, and money on safety initiatives, on the quality initiatives. We are spending the time on those things, but we could be spending more. We could be more focused on the right activities of value instead of these other capacity sucking activities when things don't work the way they should. And then last layer is like product recall, wrong product on the wrong patient, et cetera. Like these, without the right checks and balances in place, these things happen. Right? Wrong drug given, wrong implant, wrong situation, and a really significant inability to do large volume recalls.
So those current supply chain system doesn't have that ability to know what we have, where we have it, and who needs it, especially like who needs it today. But what the other thing you're getting at, Alex, is safety. Wrong product, wrong medication, wrong size, whatever the wrong is. Do we actually know, do you think, what the actual impact of those wrongs or those harms is? That if a supply chain, if we have no visibility to products, I have to think we have very little visibility to when it doesn't work and when we've used something incorrectly. Is that
Yeah, no, yeah, it's a longer answer here. I apologize, but it's sort of three parts of what I'd like to say here is the first and quick answer is no, we can't. We're blind. Right? We're blind, so you can't know how bad the problem is. Like you just have no idea. Some centers, there are individual lights. Like there will be some centers, like our I can think about CEO from like that recently transitioned from one hospital to another in Ontario, who's very passionate about the space and had done a very good job at his center and would say, "Oh no, we can." And yes, and there are a few centers that can, but mostly in Canada they can't. Most centers are blind and don't know how big their problem is. Most think they're fine, and probably if we shed a bright light on it, aren't. Um, the next piece that I think I find really challenging is perception, right? I think public and clinicians and even at the executive level, everybody thinks that the supply chains have this. Everybody assumes that we're running supply chains with the same kind of digital transactions and visibility that retail and manufacturing and everybody else. Like, how could you not? Like in today's world, how can you not be scanning and having barcodes and knowing where everything is? Everybody just assumes we've already done that because everybody else, every other industry on the planet has done this. So I think, everybody just thinks we already do this, which is a huge problem.
Yeah, it is. You don't fix
And
something you don't think's broken, right? Yeah.
and then lastly, I'll resurface an analogy you've heard me use in years past, but is that like the reality in Canada is that we actually function like a really weird Walmart or other big box store. And it's like, we open the doors in the morning and
Yep.
we let everybody come into the store. There are no cash registers, no digital transactions. We just let everybody into the store, take what you want off the shelves. We have no idea what left today or what's in there. And at the end of the day, we close the doors and we run around in a manual way, try to figure out what left and how we might plan to get through the remainder of the week. And that technically is how a lot of Canadian healthcare supply chains work. There's everybody say like, oh, we do this, we do the power balancing in the stock rooms, and we have people go by, but it's very manual, very human driven, and very fragmented. And at the end of the day, it really does not come close to matching what would be best practice and standard in any other industry moving commodity.
It has to be much, much more expensive doing it so manually and so open-ended without any tracking.
For
In addition,
sure.
so at a time when our healthcare systems are exceptionally under pressure to deliver care, but do so under fixed, there's not a money tree in the center of town to go and use. It's just as you walk through that example, it's a very expensive component of health systems, that just one of the problems, in addition to safety and the impact on clinicians, has to be addressed. So let me go to that next question then. If you had the magic wand, the power, you were the, I don't know, healthcare supply chain czar for Canada, and your mandate was make this work and fix it and get it up to speed, what are the areas that have to be advanced, maybe the top 3 or 4, in order for us to make a much better healthcare supply chain, and one that Canadians and clinicians can really be confident in, given what we work with today.
Um, yeah, well, I think again, resurfacing old analogies, right? I think that we have to mandate literacy.
Yeah.
So if you're not reading barcodes, if you're not having digital transactions of the movement of your things, not just right at the like back at like the safety moment is at the patient's bedside or in the operating room as you're about to like implant something to the patient. So, but let's back up away from the patient safety transaction. Let's start at vendor, manufacturer, our own centralized warehouse or in-house warehouse in hospital. But effectively, like I think what we need to mandate is no product should come through the doors of a healthcare facility, hospital or otherwise, without being scanned and a digital transaction occurring. Like it's here, here's what it is, here's where it's going, here's what I have. So it's making sure that every healthcare jurisdiction in Canada is mandated to wear glasses and knows how to use them and read. So scan, not just for safety, but scan for like monitoring the movement of the goods. The vendor community has to be mandated to provide a UDI, unique device identifier, that everybody can use. And then in some fashion, we need we need a digital platform that can use that data and surface it and make it usable and visible. Whether that is a national registry, whether that is a collection of vendors with digital platforms that allow us to manage these things better than than existing. And we like most healthcare, not most, all healthcare jurisdictions in Canada are running ERPs, but there's something needed between an ERP like SAP or Oracle or other and the point of use and in this space that knowing where things are. I think healthcare institutions need something between that. Somewhere along the line, like the other areas of the planet have mandated at a national level the use of UDI standards, digital transactions, scanning. They've forced these behaviors either through legislation or they've motivated these behaviors through incentives. And to date, we haven't done hardly any of that, almost none of that in Canada. And I think that's I think what we need to do. It's all the technology's there. This is not new stuff. This is all like it's 30-year-old, 40, 50-year-old processes and industrial engineering knowledge. It's decades old technology that's been amended and used widely in other industries. Like it's all there. It's all readily available. It's insane that we don't do it today.
So it really sounds like, yes, the technology's all there. No question, the need is a growing need to get this into place and make sure we have the digital systems to know what we have, where we have it, where it's needed for patient care. Sounds like this is a leadership issue. The leadership of the respective systems, federal, provincial, territorial, have to just get behind it, mandate it, or create an incentive so that no matter what organization you are delivering care in, you have to advance and create and connect, in most cases, those digital systems so you know what you have for these products, where are they, and how do we make sure we get them to those clinicians and patients who need them. Have I got that right, or is that overstating it?
Yeah, no, I mean, whether it's truly a leadership thing or it's just the right burning platform in a variety of different levels, it depends on which level we take, right? Where I think the general public, I've said for many years, like the general public just doesn't know that we can't do this. And I think they need to understand that we can't and demand that it, like at a political level, demand that we do at a national and provincial level. mandating standards and understanding that like healthcare dollars need to be put to good use. And this is an area where they're not, like where we have waste that's unacceptable. Safety, where we have like gaps in safety related to this, most certainly. And then at the individual sort of health authority and hospital level, I'd say the burning platform really is it's finances, right? I think hospitals and health authorities, they do know that their supply chains are a significant portion of their spend and that they have inefficiencies in those supply chains. And I've certainly had conversations with several, like lots of jurisdictions across Canada, where they do understand this. What the challenge is each one's trying to do this on their own in a space that isn't well supported, incentivized, or funded, and it requires initially some upfront capital investment, time, and energy. And health authorities are in the business of dealing with the fires of today, or the burden that they're trying to get through, and this just continues to sit just far enough below the daily fire radar that it doesn't get paid attention to. And unless they know they want to, but they're pointed and forced to focus on so many different things, unless the policy setting ministries and federal government, among otherwise, unless they force or support the health authorities and hospitals to, hey, pay attention to this. We need you to pay attention. We want you to pay attention to this. We'll mandate you to pay attention to this. Then they're busy paying attention to all the other things that they've been mandated to pay attention to. Right.
The
And so,
crisis at the moment, right? So yeah.
yeah, exactly. And so we just haven't, there hasn't been a crisis here. And like, love Canadian health. Like we're so resilient. Like everybody is incredibly agile and doing whatever they can to bend over backwards and make this whole thing work, like in so many different ways. And that spills through to supply chain. We're making it work. It's ugly, and everybody just doesn't see how ugly it is and how wasteful it is. We're making it work. It just shouldn't work this way. And I can't not capture that. I think that there's huge money here, right? There's
Right.
pay in the patient safety space. There's cost avoidance of the avoidable events, among other things, related to wrong patient, wrong drug, wrong equipment, all those sorts of things. But beyond that, there's real cash in pocket return on investment in the like expired goods that didn't need to expire, keeping too much stock on hand, buying products, buying three of the same things on the same day off three different contracts or at three different prices without knowing you did that. These are the things that are happening across Canadian healthcare that are wasting, a large amount of Canadian healthcare dollars that should be spent on patient care, not on inefficiency.
One more question. I get asked a lot lately, for reasons I'm sure you can imagine. Where and how does the many challenges and opportunities to improve healthcare supply chain, how do you see that being impacted or even strengthened by this entire Canada First? Let's come together as a country, be much more self-reliant than where we've been for, decades, relying so heavily on other countries for sourcing our products, our health products, particularly in our country to the south of us. Is there an opportunity for that burning platform that you suggest to advance a more Canada First type of supply chain? In order to do that, of course, that means you've got to have that digital infrastructure that you described so eloquently. What do you think? Does that play a role here, in this advancing and mobilizing the many layers of our system to prioritize healthcare supply chain?
Um, so it feels like you desperately want to say, oh yeah, you do. And the
Yeah.
reality is I'm going to say is no.
Okay. Okay.
Is I don't think, but like, I think it's still important to explain a little bit.
Sure.
Um, do I think that we should be able to scan something and know and have a clear understanding as to where it came from, both from a business and financial standpoint, but also from a, quality and safety standpoint and a general, like,
Right.
general knowledge? And yes, because we learned that lesson with PPE during the COVID pandemic.
Right.
Right. We really struggled to know what we had, the new stuff that we were buying from all over, where was it coming from? Could we trust it? So that lesson has been learned. Like we really, really
Yeah.
do need some visibility on where things come from.
Yeah.
In terms of leveraging the tariff situation for a Canada First medical device, medical product, the challenge, and we learned this during the COVID pandemic, is what was really clear is like we have such little current capacity in this country producing the things of value that we need in healthcare. And when we did try to do them, the cost and the quality in some circumstances really were prohibitive.
Right.
At some point in the future, if this sector evolves and we do manage to produce more of the things that we need in healthcare inside our country with other products, like great. And
Right.
a digitally supported supply chain with the right transactions and visibility would absolutely support that and make that system run much better.
Mhm.
Important to say, I think healthcare really needs the best products that it can get at the greatest value, and that makes the most sense to have a diversified global supply chain, like produce the stuff with,
Sure.
get the right people making the right stuff in the right places, and get it here and having a diversified supply chain. The other lesson though is what is important is even if we don't get it here, we really don't want all our eggs in one basket. Like I think that
Yeah.
the U.S. situation is another one of these opportunities where similar to like there's a region in Mexico that makes a whole pile of I think it was the MDR, like the sterility processing gear,
Right.
was subject to a natural disaster, and then nobody could get any sterilizers.
Right.
We have hubs that produce like enormous amounts of the drugs available on the planet that when they have a natural disaster or other problems, all of a sudden we have shortages. So this very constrained supply chain where we have specific regions of the planet that produce the majority of this thing that healthcare needs, we need to protect ourselves against that. So whether it's produced in Canada, but what we really need to make sure is at the very least, we've got two or three global sources
Right.
for the things that we need. So for a whole variety of reasons, be it tariffs, be it conflict, be it natural disaster, we can still obtain the products that we require if one particular region of supply is constrained and can't produce, we can't get it from there. So and a highly visible supply chain would allow us to be agile, to
Right.
be to know, hey, the products I'm missing today are from this region. That region, it can't supply me right now. I know that I can get these products from this other region. I can pivot quickly in a digital, highly visible environment versus what we were doing during the pandemic, which was entirely, manual and cumbersome and very scary.
And crisis oriented. So, all to
Yeah.
say, it's not really going to be the burning platform, but unless we advance much greater digitally transparent, visible, and automated supply chain in healthcare, we're not going to be able to do the work we need to do around diversifying our sources so we're not so reliant on one country and really making sure you do have access to the best products where they're needed most for the patients who need them to manage their care and or maybe even prevent disease as you started way back in the beginning of this interview. Alex, I
Yeah.
cannot thank you enough for your time today. You bring such a unique and critical lens to the realities of healthcare supply chain challenges right at the point of care for clinicians and patients who really have to navigate a pretty tough, challenging system because of where we find ourselves. So thank you ever so much. So grateful to have your time today.
You're very welcome, man. A pleasure to talk about this anytime.